A 35-year-old first-time donor suddenly passes out as she is donating blood. She is not known to have any medical problem in the past. Which of the following steps would be the least useful in managing the adverse event? Ensure donor is adequately hydrated and has not skipped a meal. Alleviating the donor's leg as this is usually due to vasovagal syncope. Ensure the hemoglobin of the donor meets the minimum requirement of the donation. The donation is continued along with a simultaneous normal saline infusion. The donor should be encouraged to mobilize after they have recovered. In this answer, they're asking about a lady who came to the hospital for donating the blood, but she passes out. And the passes out means she faints away, not the death. So what would be the least useful management in this case? We have to choose the one that is not appropriate according to the condition or least useful. So the answer here is the donation is continued along with a simultaneous normal saline infusion. It's because it can be dangerous for the health of that person. The question may seem tricky, but it's actually really simple. You need to read the question well. It states the least useful, as I said. A is correct because the blood donor should ensure they are well hydrated before starting transfusion or blood donation. B is correct because elevation of the leg would cause more blood to return to the heart and hence more blood to be pumped to the brain. So this can also help in recovery of the patient. C is people should not donate blood if their hemoglobin level is below the lower limit of the normal. So we should check in advance if the patient's hemoglobin level or the person who is donating the blood has the hemoglobin level appropriate. If he is also deficient of the hemoglobin, then there is no way we can donate or get blood from him. E is correct because the donor should be encouraged to eat, rest and continue their normal activities as soon as possible after the donation. This leaves us with a D. If a donor faints while giving blood, you immediately stop. Because you should not continue bleeding the donor if an adverse event has occurred or is about to occur. So this can be dangerous for the person. So the donation should be stopped immediately once the patient faints away.